everyone. I'm Kristen Kokeman, President and CEO of the ALS Association Greater New York Chapter. I apologize for the delay in getting started as we work through some technical difficulties, but thank you so much for joining us for our final day of the Education and Resource Summit and today's session, Making a Difference as an ALS Advocate at the State and Federal Level. We have a number of advocates joining us to present today for what I am sure will be a very informative and motivational discussion. But before we begin, I would like to introduce a special message from New York State Senate Majority Leader, Andrea Stewart-Cousins. Senator Cousins has been a champion of the ALS community for years, working with us to advance our initiatives and helping to secure the much needed state funding that supports our Vital Care Service program. We are so grateful to Senator Cousins and the New York State Legislature for their incredible efforts on our behalf. Thank you.
Hello, I'm Senate Majority Leader Andrea Stewart-Cousins. Thank you so much for inviting me to address you as part of this year's Virtual Education and Resource Summit. I applaud the ALS Association of Greater New York for organizing this event and for their dedication to combating ALS. Your continued advocacy for those living with ALS uplifts the voices of many and gives us a chance to stand united against this tragic disease. Many are familiar with ALS due to Pat Quinn, the co-founder of the Ice Bucket Challenge, who unfortunately passed last year. Pat was from my district. He was a friend and one of my all-time personal heroes. I was proud to sponsor a special Senate resolution to honor him. My heart goes out to his family and all the families who've lost someone due to ALS. Pat made the best of the worst situation. His unyielding devotion left a legacy of change and progress. He was an inspiration. His courage and tenacity sparked millions to take action, including me. The Ice Bucket Challenge was more than an internet phenomenon. It raised awareness, raised funds, and created a sense of hope and community. In the Senate Democratic majority, my colleagues and I have continued our efforts in the fight to defeat ALS. We know that there are high costs for medical care, equipment, and home health care. That's why we passed legislation that provides a way for New Yorkers to donate to the ALS Fund directly through a checkoff box on personal or corporate income tax forms. These funds will support critical programs and services to improve the quality of life for individuals and their families coping with ALS. We also make funding for the ALS Association Greater New York Chapter part of our annual budget additions, making sure New York can provide high-quality support and care and services to ease the pain of those living with ALS and their families throughout New York State. Our conference understands our responsibility to do all we can to make lives easier and provide relief while we work towards prevention and a cure. I look forward to continuing our work together to shine a light on this under-recognized disease. And again, I want to thank the ALS Association of New York for your commitment to defeating ALS and for all your hard work. I hope that one day, amyotrophic lateral sclerosis will be a disease of the past. Thank you.
Oh, thank you all, and much thanks to the Majority Leader for her wonderful words for us today. So my name is Tiffany Card. I'm joined here by Debbie Schlossberg. We're going to be your your moderators today. Maybe I need another cup of coffee. We're going to hear from Rebecca, Nirmal, and Paul, and Jeremy as some of our fiercest advocates for ALS. Just a brief introduction, first of all. Debbie Schlossberg is one of our patient services coordinators for the ALS Association Greater New York Chapter. Debbie has worked at the chapter since 2004, and Debbie has co-facilitated our support groups and is the clinic's social worker at both HUMC and RWJ ALS clinics, and has been involved in the chapter advocacy initiatives. Previously, Debbie was a social worker in settings related to hospice and aging. Debbie also has experience as a community organizer in the US and abroad. Welcome, Debbie.
And my co-moderator, Tiffany Card, has worked in both nonprofit and government as the Director of Public Affairs and Communications for a large healthcare nonprofit and the Chief of Staff for a member of the New York State Assembly and New York City Council member. She has worked with many lawmakers at the state and federal level on sexual and reproductive rights, women's equality, and social justice. As the Assistant Director of Communications and Advocacy at the ALS Greater New York chapter, she's responsible for sharing the work of our chapter and advocating for a better world, which allows her to combine her passion for storytelling and changing the world for the better. She graduated from Ohio University with a BFA in theater and acting and looks forward to the day, which is coming soon, when we can all get back to the theater. Tiff, take it away.
Great. So I'm going to go ahead and share my screen here. You all see that?
Yes.
Wonderful. So today we are going to talk about advocacy. If I can go to the next slide, that would be helpful. Sorry, hit a tag here. Here we go. Advocacy 101. So basically, what is advocacy? We're going to talk today about supporting, defending, and arguing for a specific cause that'll bring about awareness or change. And oftentimes that can be accomplished through raising public awareness, increasing support, influencing policy for a certain issue. And of course, we're talking about specifically ALS and funding around ALS and legislation around ALS, all of those kinds of things. When we get together as a group, we are unstoppable. There are different types of advocacy. There's self-advocacy, which we talked about yesterday. There was a session on self-advocacy. There's individual advocacy and systems advocacy. And we're going to focus this particular hour on systems advocacy. And that's really getting together to make change on policy or rules or laws. This can happen at a local level, a state level, or a national level. And so that's what we're going to be focusing on today. So why advocate? Very often we feel like, does it really make a difference? And actually, we're going to show you a few instances where we've made a huge difference, particularly with the help of those 4 individuals and others like them that you'll hear from later today. Advocacy helps others understand your point of view and support your cause. And the goal of advocacy is to affect change on the issues that you care about. So whether it's ALS, it might be healthcare, it might be, making sure that the Social Security that we know is so vital to everyone in our community, that you're actually able to access at the time that you need to access it. So the goal is to affect change on the issues that you care about. So there's a couple of examples of that: contacting your member of Congress, state and local officials, attending a march or a protest, organizing a campaign in your community or on social media, writing an op-ed letter to the editor of your local newspaper, and starting a petition are just a few examples of things that can be very effective when trying to communicate about your particular issue and making change with those particular lawmakers. So Debbie, I think you can go on to the next piece. Unmute yourself, Debbie.
Thanks for that. Just this year alone, we've had some very, very significant and meaningful accomplishments, and we wanted to sort of run through them so you can see an example of exactly what Tiffany is talking about, how we all can make a difference. One of our most dramatic successes this year was that we were able to end the 5-month waiting period for people living with ALS when they get Social Security disability. Previously, when a person went on Social Security disability, even with a diagnosis of ALS, even though they were able to get Medicare automatically, they had to wait 5 months for both of those things to kick in. And as of December 2020, that wait has been eliminated. Additionally, we've been very successful in getting promises of increased funding for both the ALS research program at the Department of Defense and for the NIH, where we increased the funding from 83 million in fiscal year 2018 to 105 million. We were able to also protect access to non-invasive ventilators for Medicare beneficiaries with ALS. And you want to go to the next slide, please? And some of our more historic but no less meaningful accomplishments include the elimination of the 2-year wait period for Medicare. I alluded a moment ago to the fact that we eliminated the 5-month wait, but every American who goes on Social Security disability has to wait 2 years in order to get the Medicare that goes along with that. But we were able to eliminate that 2-year wait altogether so that automatically any person with a bona fide diagnosis of ALS who receives Social Security disability automatically together with that gets Medicare. We were able to bring the VA to designate ALS as a service-connected disability, which means that any veteran, doesn't matter when they served, where they served, or what they did, as long as they served for 90 days and had an honorable discharge, with a bona fide diagnosis of ALS is eligible for a full complement of disability benefits through the VA. We were able to establish the ALS registry, which is currently the biggest ALS research project in the United States, together with its biorepository at the CDC, as well as initiating and now increasing every year funding for research through the NIH and Department of Defense. Next slide, please. And this is just an illustration of how you can see since 2016 how our advocacy efforts have resulted every year in increased funding in all of those realms, from about an $80 million allocation in 2016 to $180 million in 2021. Tiff?
Great. Thank you so much. There I am. We are going to now hear, very excitingly, from Paul Weissman. Paul Weissman, in the 8 years that he's been living with ALS, Paul has done a lot of advocacy work. He's proud to have been down to Washington, D.C. with the Greater New York chapter, and also proud to be on the board of directors for the ALS Ride for Life. Paul has spoken publicly in schools all across Long Island, raising awareness about ALS. Paul, take it away.
Hi, thank you all for having me here today. And this conference, you're on to something. This is great. So yeah, I've been down to DC 4 times so far. The first time going down there, I had no idea what I was getting myself into. But one of the things I learned real quickly is that all of these representatives that are down there all pretty much agree that this is not a political issue. ALS is a human issue. And I was surprised to find that so many of them have been touched by this disease personally, on a personal level. So I'm probably going to double up on some of the things we just talked about, the accomplishments. But yeah, some of them getting communications devices unlocked. That was helped through the Gleason Foundation. But setting up the national registry and the funding to go with it. So as an ALS patient, all ALS patients should be signed up with the national registry. And hopefully all the clinics out there are giving information. And I know there's people at the chapter ready to help out to get you signed up, because it's our job to help them to help us. The funding through the NIH, yes. The DOD, which we just talked about. When I first went down there, I think they were in for like 10 million in research. That doubled, and it just doubled again. So, you know, there's a lot of people out there on our side, but we have to keep on them to make sure they keep the research up. And we talked about the VA. I guess years ago, somebody figured out that for some reason, if you were in the military, you would twice as likely to be diagnosed with ALS. So we brought that to the VA, and naturally they tried to disprove it, but the more they tried to disprove it, the more they realized, yeah, this is a thing and we need to do something about that. So kudos for them for getting on board. And if you served in the military, you go right to the front of the line, as you should. Social Security disability insurance. My wife and I, who, by the way, I have to thank Mary Beth for helping me set up here today. She was also down in Washington the last time with us, and she loved it. She can't wait to get back there. But when I was first diagnosed, I mean, you have so much on your plate to think about, that money's hemorrhaging out the window. The last thing you need to be worried about is the insurance for Social Security. So I'm very, very proud to be part of the group that got that passed to eliminate the 5-month waiting period. To me, advocacy and awareness go hand in hand. You know, I've spoken in schools all across the island, tens of thousands of students, and I know some of them have picked up the cause and are trying to help us out. But, you know, I guess putting them together is a great thing, because a couple of years back, I managed to walk from Yankee Stadium to Washington, D.C. to speak on Capitol Hill with the Greater New York chapter. And we stopped at towns and cities all across, up and down the East Coast. So to know we made a difference, and I know they were paying attention, because I actually still hear from some of them. So advocacy is hugely important, just to stay in front of all these representatives' faces. This conference, the 3 days, is, I think it was Jillian had said, yeah, we've discovered this is kind of a silver lining during the pandemic, which got me to thinking, yes, it is a silver lining, still pandemic, but advocacy, it makes it so much easier for all of us to be advocates. You know, we don't have to worry about going down to DC. How do we get down there? What's it going to cost? All of these things. We're all advocates right now from our own homes, and it's that simple. So I'm going to challenge everybody, especially the patients, everybody. You can be an advocate right now. When this conference is over later, go online, look up your representatives, your Congress people, your senators, look up your federal representatives, email them, send them an email, let them know you're here, let them know you have ALS, let them know you're concerned about ALS, let them know you're here, and let them know we are coming and we will be heard. So I'm going to leave you with that one. So peace, love, and cure ALS. Thank y'all.
Woohoo! Thank you, Paul. That was great. We will have a Q&A. You can see that there's a Q&A button at the bottom of your screen. You can type in your questions, and we will take all your questions at the end of our session. If we don't get to them during this particular session, considering we did start a few minutes late, we will have a wrap-up session this afternoon at 3:45 with our staff. So anything that does not get answered this morning can certainly be answered this afternoon. So that was wonderful, Paul. We're going to continue on with Jeremy Schreiber, who I'm going to introduce, and then I'm going to actually play sound from Jeremy and a slideshow. So just give me a few minutes to kind of figure all of that technical stuff out. But first, I'm going to introduce another fierce warrior here. Jeremy Schreiber is an entrepreneur, a writer, and an ALS warrior. He first started to write and speak openly about his experiences after being diagnosed with ALS in January 2018. From his personal story, he offers unique perspective into a world where injustice is infrequent and unapologetically out in the open. Through his work, Jeremy aims to help and motivate people with disabilities to improve their lives and to overcome the challenges they face. He also gives a voice to people whose society has turned invisible, covering such topics as travel, new treatments, medical marijuana, and technology. And speaking of technology, give me a few seconds here to get this set up. Going to screen share.
Still maybe, right?
Let me see here. Go there.
Thank you for inviting me to be a part of this
Can you
today.
hear it?
If it weren't for the pandemic and Zoom, to be in person today, I would have to put pants on. My name is Jeremy Schreiber, and I'm going to tell you about my experience giving a testimony to the New Jersey State Senate. And that anyone can be an advocate. The next slide, please. When Kristen and Tiffany asked me if I wanted to do this thing with them, I immediately said yes. It was this kind of leaping before looking that got me in all sorts of crazy situations. It was right after I agreed that they told me the audience was the New Jersey State Senate Budget Commission. I would be asking for $1 million, and, oh yeah, I had 3 days to prepare. This time, the audible gulp I made didn't mean I needed the cough assist. To get prepared, I asked to see the testimony from the previous year. That way I would have a template to go off. Tiffany and Kristen, you know I love you, but it reads the way you would expect a pitch to a bunch of lawmakers would sound. The next slide, please. The story was easy to tell. And having spent a decade and a half in sales, charging $1 million for something wasn't a big deal. The challenge was making sure the commission understood the value they were getting for the money. I shaped my testimony like a classic fabled Disney story. Rather than talking about all the things they could do for us, I wanted to make each person on the commission feel like he or she had the power to save my life. Each organization that wants money from New Jersey shows up and pleads their case. Which I took to mean that I would have some serious competition. This was right as the pandemic was about to change life as we know it. Fortunately, only the brave, or crazy, organizations showed up. It was sparsely attended, so we were bumped in the roster, and I was next. With the help of my parents and Debbie Schlossberg, I rolled up to the hot seat. In front of me was an impossibly long, unusually elevated, bar mitzvah-style dais filled with all sorts of important people. Over the next 4 minutes and 32 seconds, I told the story of how this unacceptable disease crept into our lives and sent us into a tailspin. Over the next few months, I watched the state websites for any sign that the effort we put in would be rewarded. It was then that Tiffany reached out to tell me that we were awarded the money. It was exhilarating, and I knew that state did the right thing, and we would get the help we needed. The next slide, please. The last thing, I'm about to publish a book. When I started writing, I focused on my experience going from an able-bodied guy living happily in New York City, to joining the ranks of the medically confused. What the book more
Tiffany, I'm not seeing slides.
Yeah, I don't know how to change that.
Okay.
I'll show them after this is over.
this opportunity today. Thank you for inviting me to be a part of this today.
All right, sorry about that. Let me stop share. Where in here? Sorry about this. I have no. Okay. Okay, sorry about that. I hope you all heard Jeremy's story.
Yep.
Did you? No, I can't hear anyone.
Yes, we heard
Yes,
it.
we,
Okay.
yes, we
great.
did.
I even saw a glimpse of Invisible Nation at the very end. That slide did show for a nanosecond. So,
Okay, let
thank you,
me
Jeremy.
I'll go ahead and I can just show those. Apparently, I don't know how to show two things at one time. So sorry about that.
Were you going to go ahead and do something now?
Here, I think I can put these up right now just so folks can see this. Do you see that?
Yes.
So I'm just going to go, there are just a few slides here, which I can't control either. So you at least get to see and hear that Jeremy's testimony was extremely crucial to getting our funding for New Jersey. So we are incredibly grateful and thanks to him for his advocacy. We will be having an event in May where you'll be able to hear more about his journey, and we'll be having selections from his book being read by actor James Naughton. So stay tuned for that exciting news. Okay, Debbie, did you want to go ahead and introduce our next speaker?
Happily, yes. Nirmal. Nirmal Shah's wife, Sonal, was diagnosed with ALS in 2012 at the age of 62. Sonal knew that she then had a limited time and was determined to make a difference. She embarked upon a journey as a passionate advocate to state and federal governments, got the state of New Jersey to declare May as ALS Awareness Month, diligently fundraised for the ALS Association, and wrote a book about her journey called My Life, Legacy, and ALS. Sonal passed away in November of 2015. Nirmal and Sonal met in 1981, married in 1983 in New York City. They have one daughter, Nurali, who is an attorney in New York City and is currently on the board of the ALS Association Greater New York chapter. And she was the former president of our ALS Young Professionals Group. Nirmal worked at Nokia, formerly Lucent Technologies, and then Alcatel-Lucent. Anybody in New Jersey knows these names, for over 20 years and retired as a director in 2018. Nirmal and his family lived in Basking Ridge, New Jersey for almost 20 years, and he currently lives in Somerset. He's carrying on Sonal's legacy by continuing the advocacy work as well as raising funds for ALS research. Nirmal, tell us about your experience.
Thank you all very much for inviting me. Good morning, everyone. Let me share my screen and my slides. Can you see my slides?
Yep.
Okay, good. All right. So, we had two great talks, and from Paul as well as Jeremy. Paul talked about a lot of the advocacy work that ALS Association has been doing together with the chapter with the Congress and Senate in Washington D.C. And Jeremy has done fantastic work with the New Jersey at the state level, trying to make sure that we get money, right, for ALS Association and for the services that ALS Association is providing. So I really want to thank them both. And I want to talk a little bit more about what we can do to make a difference as an advocate at the state level. And prior to talking about that, I just want to talk a little bit about myself. And I really got involved with this whole ALS situation when Sonal got diagnosed with ALS, and that's why I really want to say, my name, but I really want to say husband of Sonal Shah rather than anything else. That's my title, okay? And I've also given you my website with the websites that Sonal created before she passed away. All right. And that's the cover of the book. So as Debbie mentioned, Sonal was diagnosed in June of 2012 at the age of 62. And I think my screen is, let me just, okay. All right. And as her disease progressed, things started getting very difficult. And, and I really was, at one point in time, I was reasonably depressed because I didn't know how to handle the difficulties that Sonal was having um, with as the disease progressed, and she was becoming less and less mobile. And then at that time, it was like a godsend. A friend came along, introduced us to ALS Association of Greater New York, and I really, they were, such a godsend because they really started helping us. And I know Debbie was involved, giving us some ideas about what we would expect, what we can expect. Ben Lehman from from the chapter in New York was also involved. And this really helped us get involved with what ALS Association has been doing. So we went to our first advocacy conference in Washington, D.C. in 2013. And it really opened our eyes as to what advocacy can achieve. And we talked about, and Paul has talked about that, about all the achievements. That Debbie has talked about all the achievements over years. And this is when we started in 2013, right? And after coming from the conference, Sonal felt that we need to do something in New Jersey as well. And one of the ideas that came to Sonal was that, why are we not able to, have state of New Jersey recognize ALS? And she started working on that declaration, okay? And this was sometime in early 2014. I'll talk a little bit more about that process and what actually took place. And then just to finish up on my involvement, she started writing a book on her life and ALS in September 2014. I know it was quite a difficult task for her because towards the end, when she was writing it, she couldn't type on the keyboard very well. All her fingers were curled up, and it was a huge struggle. But it was published in February 2015. You saw the cover on the first slide, and then she passed away. Sadly in November of 2015 after about 3.5 years suffering from the disease. And as Debbie said, our daughter Nirali Shah is currently very, very active now with ALS Association, and she's actually on the board of the chapter, and she also was the past president of the Young Professionals Group. So I just want to talk a little about the timeline to get this declaration done, right? So what we started doing was Sonal and we started approaching some local people in the town to say that this is something we would like to do. And, we started approaching them after we came back from the conference in May, and who then introduced us to our assemblywoman, Nancy Munoz. And after talking to her several times and she visiting us, she agreed to sponsor a resolution in New Jersey State Assembly. Okay, so the resolution was drafted to declare May as the ALS Awareness Month, and actually the third Wednesday in each month, third Wednesday in the month of May as the ALS Awareness Day. But once the resolution was introduced in May of 2014, right? Sonal and I had gone to to make a presentation about why it is important to have that recognition, right? It took about over a year, to get that resolution passed in the assembly, right? And it required constant prodding, pushing, and as Paul had said and Jeremy said, it's the squeaky wheel that gets the grease. You have to keep on pushing that. Otherwise, there are so many other pressures on the assemblyman, other agenda items, etc., that, these kind of things can easily get sidetracked, right? In September of, in July of that same year, after Assembly passed it, the resolution was passed by the Senate, and then in October 13th, it was approved and signed by the governor, right? So I think it was quite a journey. You see a picture of our lieutenant governor at that time, Kim Giordano, had come to our house to present the declaration after it was passed, and that's Kim. That's Kim and Sonal's mother on the side. Okay. So now what I wanted to talk about is really saying that all these things have been done, but this is a constant effort about doing advocacy work and raising awareness about ALS, because you know what, out of sight is out of mind. Okay, so this, what I would really urge all of us to be doing is to write about about the ALS Awareness Month, and essentially using that declaration to do more awareness of ALS. In month of May is coming up. Write in your Facebook about this ALS Awareness Month, right? In your Instagram, Twitter, whatever social media you have. If the more you write about it, the more people get to know about it. I mean, and I think it helps creating that environment whereby when we go to get funding from the federal government, from the state government, or for any other things that we want, it really helps because people understand how devastating this disease is. Right? Write letters to the local newspaper, saying that, and let them know that the May is an ALS awareness. They're always looking for stories. And I know that when, Sonal gave so many interviews to our local papers, Star Ledger, and other newspapers that, and a lot of articles got published. And that all helps because it's a constant reminder that we need to provide to the public about our issues. Okay. Stories about, especially people with ALS, if they write a story about what they're going through, what are the struggles, what are the issues they are facing, what they've been able to overcome. Those stories are really, really interesting for people to read, and it increases awareness. And the newspapers are really always want the local stories about local people. So, right? Writing letters to our representative about ALS Awareness Month and need for support for grant. As Jeremy is doing a lot of good work with our in New Jersey, but we can do the same thing and same thing is probably done in New York as well. And but I think we can also use the same philosophy to try and get New York to declare an ALS Awareness Day and a month. Okay. Now I know our next speaker, Becky, is going to be talking about the Youth Action Day. That is on May 15th. Again, we should participate in the Youth Action Day and support that activity. Again, that will help increase the advocacy, awareness, right? And then obviously, as you all know, many of you know, every year, there is this walk to defeat ALS. I know this year is going to be done virtually in your own home, but participate, raise funds, right? We, the team Sonal, we have been participating in it for last 8 years. And then I'm going to leave it open. Any other suggestions that you have? But I think it's the squeaky wheel that gets the grease. And the other thing is that patients with ALS, they have so much power, in the sense that it's people really sympathize and they want to do something to help and use that to actually get more and more awareness and more funding, more and more legislations passed, etc. Okay.
Nirmal, oh, I'm sorry. Continue. I thought you were.
Yes, I'm done. Thank you.
Okay, thank you so much. It was, first of all, it was heartwarming to see the beautiful photos of Sonal and all the ways that you're continuing her legacy. And I think you did a really, really masterful job connecting the dots for everybody in terms of how local awareness, starting local and just raising awareness really, really is the first and crucial step to achieving outcomes, which you and your family have done. So thank you again. And we'll talk about some suggestions at the end. But right now, I'd like to turn to our next panelist, Rebecca. Becky, what do you prefer?
Becky's fine.
Becky, okay. Becky Emmerich Wetzel graduated from the University of North Carolina with a BA in elementary education and from Teachers College, Columbia University with an MA in applied educational psychology. She has been a teacher, a literacy specialist, educational consultant, and social entrepreneur. Becky developed a strong passion for philanthropic work after watching her father and grandfather battle ALS and benefit from the help of the Catfish Hunter chapter of the ALS Association. She has been an active supporter of ALS causes and organizations for a very long time. And most recently, she created and developed a nationwide awareness and fundraising campaign called the ALS Youth Challenge. And we're going to hear all about it right now. Becky, thank you for joining us.
Thank you. Thank you for having me today. Hello, good morning to everyone. As was mentioned, my connection to ALS began when I was 6 years old. At that time, I lost my grandfather. And then in 2008, I sadly lost my father to ALS. And about 5 years ago, my aunt was diagnosed with FTD, which if you haven't heard of that, it's a form of dementia, which is genetically linked to ALS. So given her diagnosis, it was found out that she carries the C9orf72 gene mutation. It was discovered that our family has familial ALS, which gives me a 50% chance of carrying that gene, and if I carry it, developing ALS or FTD. So when that was found out, our family has been active in the ALS Association for a number of years. But when that was found out, I decided I needed to be even more active. So I decided I wanted to help in a new way. So I looked across every ALS chapter's website to look for what everyone was doing and some things that might not be happening yet. I additionally looked at other nonprofits that address other diseases to see what they were doing and that the ALS Association wasn't doing yet. Given my background as an educator, the ages at which I experienced ALS within my own family, and the ages of my two young daughters, I identified a need to support and empower the youth within the ALS community. So I came up with the idea for the ALS Youth Challenge. And just so you understand a little bit about that, its mission is to inspire, organize, and mobilize youth to participate in youth-led events which either educate or raise awareness or raise funds for the ALS Association. So actually, it's coming up May 15th. If anyone would like to participate, there's more information on the Greater New York website. And there's also the toolkit, which kind of lays out all the different activities that youth can participate in, will be on this website, hopefully by the end of the day. And just so you understand, there are a number of different activities, some of which take not a lot of time, and then some take a little bit more time. And it's all around raising awareness and becoming an advocate at an early age. So sometimes one of the activities might be to have youth, and this could be kids, teenagers, young adults, anyone can get involved, to write letters to Congress, or simply make an educational presentation to take to their school and explain to the school how ALS is affecting their lives. So after I came up with this idea, I went to the local chapter, Greater New York chapter, and they were wonderful and very supportive. And we started at the local level the first year. My girls decided they wanted to have an iced tea stand to kind of go inside with the ice bucket challenge. And we contacted everyone at the local level, our neighbors, the Girl Scout troops, the school, and we had iced tea stands throughout the community. And what was great about it,
raised money, but besides raising money, it really raised awareness in new areas. It brought ALS visibility to people who had never heard of it before because we were out in the community. We were on Main Street. So as people were walking by, they might not have ever heard of ALS. And as they came to get their cup of iced tea, the girls were able to explain to them what ALS was, how it's affected our family, and most importantly, why we need more money for research and more funding for ALS. So after that first year, then we were also able to go to Congress and have an iced tea stand in one of the cafeterias on Capitol Hill. So in order to do that, I contacted our congressman at that time was Frinlinghausen. I contacted his aides. Oftentimes it helps to try with the aides first if you're making an ask of Congress. So after many, many emails, we tracked down the right person to get the permission, and we were able to go to Capitol Hill and have the iced tea stand, not to ask for donations, but just to raise awareness. They met with many aides, and a few congressmen and women came down, listened to the girls, explain why ALS was important to them and why more funding was needed. So after that first year and those successes, both in the very local level and on Capitol Hill, I went to the national board of the ALS Association. They agreed to help develop the ALS Challenge, and now it's out to all chapters across the United States. So that's a very short version of the journey that was probably took over 4 years. I'm just going to quickly go over some of the main things that I've learned through this whole process. The first thing that I learned was to not be afraid to ask questions to anyone. You will be very surprised by how many people really want to help you, from your friends and neighbors to even congressional aides. Your local aides will really want to listen to what your needs are, and they'll try to help you as much as possible. The second thing I learned is to not accept the first no that you get, because you will get some no's. And so I learned to ask it either a different person or ask it a different way. And so just to have that keep trying and that consistency, and eventually you'll get to a yes oftentimes. Going along with that, the third thing I learned was to not be afraid to send multiple emails. Oftentimes you won't get a response to your first email, so always follow up. Emails get lost or get forgotten. Also keep emails short because they're more likely to be read that way. The fourth thing I learned, and this goes along with what Normal was just saying, really get to know your local leaders, from your mayor to your city council member, your New Jersey assemblymen and women, your local newspaper editors. All of those people will be able to give whatever activity you're doing, your idea, a lot of traction, visibility, which is very important, and then permits for things, because you need permits for an iced tea stand on Main Street. The last thing I would say is to believe in yourself and believe in your idea. If you've identified a need within this community and a new innovative way to address that need, stick with it. It may take a number of months or weeks or years to really get it up and moving, but to keep going. So finally, I'm just going to close with, I hope that some of you might join us on May 15th. If that day doesn't work, you can do it any day in May, really, for Youth Action Day. It's really a fun way to get the next generation involved and at the same time support kids who are in families that are experiencing ALS. They will feel empowered when they complete these activities. They will feel like they are able to take a stand against this disease, because I know in my own experience as a child going through this, you often felt helpless. But when you take an action and you do something to raise awareness, you as a child will feel very empowered. So thank you.
Thank you. That was really wonderful. It's really great to see how that local advocacy really spreads from a real grassroots level all the way up to the halls of Congress. So thank you so much for that. We do have about 15, 13 minutes left, and we have a couple of questions perhaps. We're going to continue on just with a little bit of talking about what are our next priorities. So after hearing these great stories, you're thinking, great, I want to get involved. What can I do? So I'm going to go ahead and do a screen share again to jump to our priorities for this year. 1 second. Here we go. All right, see that?
Yep.
So I know there's been a lot of questions looking at a new piece of legislation, which is accelerating access to critical therapies, which is also known as ACT or Act for ALS, and the Promising Pathway Act. So we are definitely encouraging Congress to reintroduce and pass this important piece of legislation, and that the FDA must be fully funded and fully staffed to move the regulatory authority that they need fast and effective at speedy ALS trials and drug approvals. Just over the past month, we have been actively pursuing additional funding through all of the different departments, the Department of Defense, and various pieces of funding through all those different ways, including National Institute for Health, the CDC, actively been pursuing funding through all of that. The president's budget should be out sometime this month, so we'll find out sort of how that funding is moving forward. It's never too late to go ahead and reach out to your particular congressperson, whether it's your senator in New Jersey or New York State, or your congressional team in New York and New Jersey, and ask about funding for that particular pieces. We're also pursuing telehealth. People with ALS must continue to have full and safe access. We have been given an extension on some of the telehealth that was passed as an emergency method through COVID. So some of that has been extended as long as COVID is seen as a federal emergency. So we are grateful for that. What we would like to see, however, of course, is that those pieces of telehealth continue beyond COVID. We certainly know that our community would be greatly appreciative and quite frankly needs it, as they often cannot leave where they are. Let's see here, go to the next one. We want to provide, of course, high quality, affordable, accessible healthcare and continue down this road. Not included limit to any enhancing all aspects of healthcare coverage, protections for pre-existing conditions, reducing costs for Medicare coverage, including the home infusion and other specialized outpatient and inpatient medical care, and of course, durable medical equipment. Some of these things are covered. Of course, we want to make sure that we don't go backwards in this arena, but only expand and move forward to make sure that everyone is receiving all the possible health and coverage that they possibly can. We also want to increase veteran benefits for people with ALS and their families, as we have talked about before and has been mentioned probably several times throughout this conference, is that veterans are twice as likely to receive a diagnosis of ALS. So we need to continue the funding for the research and studies of what this is about and why this continues, and also the veterans benefits throughout our entire branch of the United States Armed Forces. So those are some of the priorities that we are really moving for right now. And now I know that Debbie is going to talk to you a little bit about what action steps you can take.
Yes, hi. So also in continuation of Nirmal's question, any suggestions to encapsulate? call your members of Congress. The numbers here in front of you are the numbers for the congressional hotlines. You can call those numbers and ask for the telephone numbers of your particular congressman or woman. Same with the senators underneath. Then to participate in the Youth Action Day, which Becky told us all about, that's on May 15th, and save the date for advocacy June 6th through 8th. Instead of Washington this year, as has been mentioned, we will be doing it virtually, but your participation is no less important. I'd like to now turn a little bit to our Q&A. We have two good questions. I'll answer the second one first because it is the easiest. Can somebody maybe put in the oh, we don't have the chat. There is a website, but if you go to our website, als-ny.org/advocacy, it will take you to the place where you can sign up to be an advocate. Once you've done that, you'll get notices every time there's a legislative action that we need help on. You'll get all the updates about everything that's going on the federal and state level as well.
Yeah, I think they're also in the Whova on this particular conference site. Becky's the Teen Hour, the Youth Advocacy Day information is located there, so folks can download the PDF. The toolkit is located in this session, as well as the slides from everybody. So folks can jump right on for youth advocacy piece. And I believe in there is also my email on how to become an advocate, and I will get in touch and reach out to folks as far as that is concerned.
And then we had another question from Alan Timothy Lunsford Stevens, and I thank you for your impassioned comment. What I'd like to say to address that is that, in the world of activism, we all know that you have to celebrate your victories. Celebrating victories not only is critical in terms of staying motivated for the fight, but it also helps us strategize as we build upon our successes, we build upon the relationships that we've been developing. So it's a very, very actually important piece of the long-term fight. Any good activist starts from a place of passion, like you, the questioner. And it's everybody's job to take that passion, use it as our fuel, and follow, hopefully, some of the steps that we've learned today from our 4 speakers and our entire presentation. So are there any other questions anywhere?
I don't see any, but I do see that in the Q&A and the chat, the registration for how to register as an advocate is located there. So if you're looking at Whova, you can see in the chat that the ALS registration and how to be an advocate is located there. So you can go ahead and sign right up. And that'll get in touch with you for a lot of different emails that come out. There's often petitions that are being circulated. We often ask for folks to reach out to their Congress people to have them sign on to Dear Colleague letters, which is how appropriations or the budget gets passed. There's also congressional members have started a ALS caucus. So congressional members in the Senate and the House of Representatives have started a bipartisanship ALS caucus. These are members who really take ALS seriously, are invested in working with all of those invested into the ALS community. So certainly finding out if your congressperson is a part of that caucus, if they are, thanking them, and if they aren't, reaching out to them and asking them to consider joining that ALS caucus, which will give them, just a ton of resources for information and how to best advocate on all of your behalf. Do you want to add anything else, anyone?
Yeah, if you don't mind. So there's a lot of good people out there in the world. They have good hearts, they care, they want to help, but they can't help unless they know about it. So it's up to us to get out there, tell our story, like you were saying, locally, federally, tell your story, let people know about it, and you'll see a difference. You'll see a change. Thank you.
That actually leads me perfectly to, I'm going to share one more slide here since I wasn't able to do it, Paul. This is for you. There we go. And see all the great advocates there working out in front of the Capitol back when, of course, we could actually do that in person. I think Kristen popped on. You might want to say something.
Yeah, I would love to. Thank you. And we will get back there. I hope that there will be a day not too far in the distant future where we will all be gathering and storming the Hill as a group. And I think that thanks to the work that each of you are doing and this presentation today, that picture will be larger with more people in it, and we will have more advocates joining us. I just want to thank each of you for your inspirational presentations, your amazing comments, not to mention the years of work that each of you have put into getting us to where we are today. Because I think that all of the accomplishments that, while yes, we are chipping away at it, but we are, because of everything that you're doing, we are able to do that work and get those things accomplished and check off those boxes and put new things on our list. We want to continually put new things on our to-do list and our accomplishment list. And I think that together, as a group, we'll get those things done. So thank you.
So
Thank you.
thank you very much. If any questions do come up for you that you would like to address at the end that maybe you think about over the next couple of hours, make sure to tune in at 3:45 where you can ask those questions at that time. For our chapter staff, we'll wrap up our 3 days of wonderful sessions. So thank you so much.
Bye, everybody. Thank you.
Thank you, guys. Thank you, thank you, thank you.
Thanks, everyone.